Let's just make sure everybody's on the same page. We want to be inclusive. Sahatna, I know you launched it at GITEX last year, a very exciting launch. It's very recent. So let's ensure everybody knows exactly what are we speaking about here, the significance behind it. So take us back to that inspiration point and exactly what is it. Please do take your mics. Yes.
Thanks, Amandeep. So I want to start with the vision of, Department of Health Abu Dhabi.
Yes.
If we talk about Department of Health Abu Dhabi, we want to build a system which is intelligent and efficient enough to take care of health of our residents. We want to build a system that can prevent, predict, and also act to make sure healthcare is more accessible, right? So if we think from that angle, Sahatna is one platform that unites the entire ecosystem of the healthcare in the Emirate and makes sure it gives our user more access to healthcare and makes it easy for them to use. Sahatna, sorry.
Yes, no, it's that. I think that's really interesting. And you already, Aman, speak of, your ambition ties into the M42 ambition as well, the Department of Health Abu Dhabi. You speak of prevention, precision, and prediction there.
Yes.
That's all part of what the Sahatna Up is about.
Exactly. And it's built on two main pillars, which is care and which is wellness. Today, if we talk about, we focus a lot on care, where, how do we make sure we enable access to teleconsultation, we enable access to your health reports, we enable access, for yourself to manage your dependents at your family. We give you access to your genomics insights, etc. Going forward, our focus in wellness, where we make sure we give you enough information, insights, so that you don't fall sick in the first place. We give you a better, healthy living life inside. So, that's how Sahatna ties in back to the overall goal and the idea behind why it should exist in first place.
And that's really interesting. So to emphasize your point, it's a platform that provides better access, a better experience for people and patients, and also allows information to prevent sickness.
Yes.
So it's a holistic approach. That sounds groundbreaking. Yeah. And before I bring in Nabeel, I'm just going to ask, that must have been a lot of hard work that went on behind the scenes to create this.
Yeah. It was, we worked with the entire industry. We had to work with the doctors, the clinicians. We needed to make sure the genomics insights that we want to provide, it's presented in the right way, the teleconsultation experience. So we did work with the entire industry to make sure it's delivered in the most accessible way possible.
Absolutely. And of course, Department of Health Abu Dhabi has been celebrated at being at the forefront of embracing innovation. We're going to come back to the point of innovation in just a moment. But if I can bring in Nabeel. Nabeel, you are the PMO Director at Abu Dhabi Health Data Services. Now, from your perspective as a director of PMO who partnered with the Department of Health to deliver Sahatna, can you tell us about the unique features that Sahatna offers and also, broadly speaking, the benefits when it comes to users?
Sure. At the beginning, when we started Sahatna journey, we started with building a wide range of services, super app that offers you different kind of services within a single app. Then we have evolved the objectives of Sahatna, and we made it like a patient-centric model that is focusing on the patient experience and the healthcare services quality in Abu Dhabi. So we came up with a product roadmap, and we prioritized some quick wins that make big difference in the healthcare services in Abu Dhabi. Again, a lot of features we have implemented so far, but I will go for the sake of time through the top 5 features and how Abu Dhabi residents can benefit from out of them. The first one is the appointment booking, where through Sahatna app you can now easily search for the nearby healthcare facility, search by the specialty, and immediately directly book an appointment through Sahatna for yourself and for your dependents as well. The second feature, which in my opinion is one of the most key features in Sahatna, which is My Health. Simply, you can easily access directly through the Sahatna app all your personal healthcare records, your patients or your medical history. Easily you can access them at any time. Yani imagine, for example, lab test results you have done 2 years back, and you want to compare them with the same tests you have done recently, and track the changes over time. This is all accessible through Sahatna now. The third one, which is teleconsultation. This feature is simply doing a teleconsultation and a virtual consultation with healthcare consultants to seek like an easy and quick healthcare advice. The fourth one is AI symptom check, which is one of the features we are really proud of. It's empowered by AI. It can assess your symptoms and give you an initial healthcare guidance, what to do exactly. The fifth one also is wellness. Through Sahatna app, you can sync Sahatna app with your wearables and also with any digital healthcare application, and that you can set through it, you can set your wellness objectives and you can track them and you can achieve them. These are the top 5 features we have implemented so far. And I would say we are at the beginning of the journey. A lot are coming to the Abu Dhabi residents through Sahatna application very soon, inshallah.
That's super interesting, and we really appreciate your insight. And it sounds like it's a very multifaceted approach. You've talked about AI there, you talked about wellness, so it's very broad ranging. And on that note, Nabeel, so thank you for that introduction. It's timely to bring in Mark. Mark, I introduced you as a Sahatna user, and of course you are a professional in the field of AI and health as well. So first of all, from a user's perspective, yourself and your family, I believe you're one of the first to come forward with a testimonial. So please do share that with our audience here today.
Sure, thank you. When Sahatna was first launched in October last year, 2 days later, we have 3 kids. This is a family story, 3 young girls. They were all sick. And so that meant needing to book appointments. We're relatively new to Abu Dhabi. We're able to easily book appointments. And the speed of response on Sahatna, of the alerts, of the notifications is very impressive. So we knew, we had confidence that the appointments were booked properly, etc. And from there, we were able to access the reports of each of the kids. They were all sick, needing different appointments at different times. So at 2 o'clock in the morning, when you need to make sure that you've got the right information for the next appointment, you have it at your fingertips. And so from a family perspective, it's very, very important. And that allowed us to navigate a health system that we were not necessarily familiar with and do so really properly.
Fantastic, Mark. And where do you join us from? Where did you move from?
Originally from Canada, spent time in Europe during the pandemic. Other family had moved here, and so we decided to move here a short time ago, and are now excited to be part of this journey of AI and healthcare, and it's definitely an exciting one.
Fantastic. Well, welcome. We welcome everybody to the UAE, especially Abu Dhabi. And to say that that's really interesting because your international experience, you'll be able to say as a user, this type of platform and app, it's not really available elsewhere, or certainly not to this sophistication.
I think that's the differentiator that I noticed. There's a lot of initiatives over the years in other countries to try and do this kind of ubiquitous super app, but they all fail because they take too long to get the data in the right way and perfect the interface. But what is here is really accessible, functional, delivers on that first version, and allows us to go beyond access to getting insights. The reports are there that we're excited about. We're excited to know more about one of my wife's comments were, okay, the interpretation of the medical report, what does this actually mean, this item in this medical report? Getting those insights, those interpretations. And as we move towards, hopefully, from what I hear of the features, the wellness component, the intelligence to have gentle nudging on an ongoing basis, we think would be, really exciting to remember what it is that we're doing, as well as at 2 o'clock in the morning get the answers to the questions that we're looking for from the AI would be fantastic.
Brilliant. Thank you so much for being so candid and sharing your personal experience. Now, I think you make some really astute points that we can unpack with both Aman and Nabeel. In terms of from a frontline doctor's perspective, what kind of feedback are you receiving from the medical professional world? And let's provide some statistics or context for our audience here today, the success of the app so far.
Sure, thanks, Aman. All the professionals that we have talked to, we have got a really good feedback. They like the fact that once the patient receives the report, it's immediately accessible. Once the prescriptions is ready, they are immediately able to look at the prescription. The fact that all their availability, everything can be managed at one place, they like it. If we talk about from the user's perspective, we have got a really amazing uptake. We have got 270,000 plus active users as of today, 14,000 users using the app every day. For an app which was launched 14th October on Jitex, this is a really great uptake, and the engagement rate that we are seeing is increasing every day as we look at the stats. So it's a really positive uptake.
That's a really significant number and definitely should be celebrated. And it's probably providing you, as the people behind the app, a lot of information in terms of iterating how the app probably since October is evolving and new ideas. So maybe let's start thinking about the future, innovation, and how you think you might shape the drive going forward. Nabeel, if I can bring you in on that, on some of the exciting features to come.
Sure. As I mentioned previously, it's a long journey and we are still at the beginning. Even we are partnering with DOH for a long-term partnership to develop and operate Sahatna. And our focus in the upcoming period will be is empowering the patient's experience, empowering the healthcare services in Abu Dhabi by adapting AI and community management tools. So again, the product roadmap is set. I will just mention maybe the top 3 that is coming very soon in our pipeline. The first one is the primary healthcare, where you can have an easy access to your preferred healthcare providers. The second one is IFHAS. We all know IFHAS. It's located in many locations within Abu Dhabi, where we will enrich IFHAS with very advanced features through Sahatna. The third one, which is one of the really most important ones, and it completes the patient journey end to end, which is the medication delivery. In medication delivery feature, you will be able to view and place a delivery request for your prescribed medication to be delivered to you through Sahatna. Maybe I would like to leave the floor also to Aman if you want to add some more features that is in our pipeline as well.
Yes, but those are really interesting and they're super fascinating. So we do appreciate you sharing them with us, Nabeel.
Thank you.
Yes, please.
Sure. I would probably build on what Mark said.
Yes.
What Mark mentioned is when he was here, the app was delivered when he needed the care, right? From here, we expand, or we want to expand to wellness. How do we make sure we just don't provide you access when you need it, but it becomes your daily app where you get insights that help you to not fall sick in first place, right? A few features that we are working on is wellness. And what we want to do under wellness is look at your data, look at your health insights, look at your genomics report, and come back to you and give you actionable points that will help you be a bit more healthier than what you are today. We are working on an AI chatbot. Like Mark mentioned, if you are at 2 a.m. and you want to understand your report, you are not feeling well, it is going to be your AI assistant where you can talk and get more actionable insights, to manage your health when you really need it. We are working on bringing the genomics report to you, looking at your genomics information and your risk profile. Can we give you some action items to help you take care of your health, be a bit more proactive about it based on the data that we have about you?
Absolutely. I think it's really exciting to hear about what's to come. And you make a very smart point, Aman. You speak about Mark's experience there at 2 a.m. in the morning. Mark referred to his wife. It raises questions. Information raises further questions. So the chatbot would be very useful because, of course, when it comes to health, we want to unpack the information we are receiving. opening. I'm going to come to you in just a moment, Mark, with a follow-up question. But if I can open it up to my audience, if you have any questions with our guests, I'm going to please volunteer a question from Dr. Fatima. If I can get a mic to Dr. Fatima, Senior VP of Clinical Development. And I have to say that Dr. Fatima has been instrumental, along with the M42 team, in organizing such amazing speakers for us to have on stage, but also knowing behind the scenes. If I can get your input, Doctora, you've been working here in the UAE for many years. Sahatna, this app, this is revolutionary from your perspective.
This is a fantastic, in fact, application, and I would like to thank you, Department of Health, of the initiative, and thank you, Malafi, for enabling it. This partnership is fantastic. As a physician, okay, this is a dream, in fact, application. What is the goal of the healthcare delivery is to optimize your patient experience. Sahatna will talk to your physician, but also will optimize this patient experience for our patient. That's really a dream application. Thank you so much. I know that this is the beginning and a lot is coming, and all clinicians are thanking you and waiting for the next. Okay. Then my question, my answer to Amandeep was focusing on patient experience. What's the feedback that you already had from a patient experience, but also from a clinician experience? Let's listen to your surveys, and especially that, let's say, you are the kings of the data. I will start with Nabeel.
I think that's a really astute question. Thank you, Doctora.
Thank you.
I put you on the spot.
Thank you, Amanda.
And I would say to my audience, Doctora has set the bar very high, so please follow up with some questions as well. Really good. Let's unpack the patient experience. Nabeel.
Sure. So we are, I would say, monitoring closely the patient experience for the Sahatna app, and we do have some statistics and even feedback surveys and studies we do regularly, and we also consider this feedback to be reflected in our product pipeline as an optimization to our features. But what I can say, most of the feedback we are receiving so far is really positive, and they are looking for more because they are seeing it useful, and they are looking to complete the patient journey. They want to experience the whole patient journey through Sahatna product. Like, for example, one of the statistics on top of what Aman mentioned, for the teleconsultation, we've just launched it in GITEX, and so far we had like more than 500 teleconsultation transaction has happened directly through Sahatna. So we are on the right track, and again, a lot coming, inshallah, on our way very soon.
Fantastic. And that's a seamless link for us to bring Mark back in as well. We're hearing about the wider patient experience. Let's hear about yours as well. And also to draw on your professional experience, Mark. This is a very open platform, very inclusive, and we want to be balanced as well as embracing the benefits of AI-enabled apps. We need to also be conscious of some of the risks that we need to mitigate. Of course, we're speaking about sharing patient information, data, privacy issues. Let's be balanced and approach it from that perspective.
I think that's absolutely essential. Having the confidence that the information is being treated properly across the board allows you to then explore and also get more educated. We're excited about from a patient perspective, the features that will allow it to simply ask questions, get further insights without having to navigate a traditional app per se, but still using all of the own patient data, which is resident in the app, and doing so in a private and secure manner. So those are key questions, making sure that the trust is there in the service, as well as the ability to access new information, get educated, and move on to the next step. Ultimately, this is about wellness. So we'd like to minimize the amount of time we spend handling our health problems as much as we can, while focusing on what we can do to live our lives in a healthy manner.
Absolutely. Now, Mark makes some really powerful points there, Aman, if I can bring you in. We want to be sharing our information in a secure, private manner where there is trust. Now, the Department of Health Abu Dhabi has been celebrated around the world with how it handled the pandemic. And this is at the heart of what you're doing in terms of your innovation, ensuring that patients have trust.
Absolutely. I think we are handling the data in the most secure way possible. And we are keeping the patient at the center of all the things that we build, right? We work with our SOC teams, we work with external vendors, we make sure the data remains in our own premises, so we are taking care of the data at most possible.
Absolutely. It's really good to have that underlined by you. I appreciate
Absolutely.
you making that point. Now, we've only got a few minutes on the clock, just to double check if you've got any more questions. Otherwise, may I ask all of our speakers to give us a last call to action? You're here on day 4 of Arab Health 2025 on the M42 main stage. Looking ahead, when we speak about these applications and we speak about innovation in health, what would be your main call to action? What would you like to see more of in the future in the health sphere? Nabeel?
I would say more empowered features by AI. We are in the era of AI now, and healthcare is one of the domains that you can hire AI algorithms or the AI I would say powers to serve the digital healthcare. So this is what we are passionate about these days, that we want to see where can we fit the AI functions or the AI features within digital healthcare era.
Okay, that's really impactful. Mark?
Well, I'm excited by what the next stage is. Integrating AI, having that conversational capability and the intelligence to nudge us in the right direction as patients is exciting. I think from having seen other systems, there's many other environments that could benefit from this kind of service being available to them. So it's tremendous, the first steps that have been taken, and over the next 12 months, hopefully there's many new releases that will be available to improve that journey.
That's a really lovely vision. And yourself, Aman, what would you like to see in the future?
Yes, I think we want to be at a place where Sahatna seamlessly fits in the day-to-day journey of a person. It's not an external part, but it becomes your daily day-to-day life that you depend on for your health insights, for taking care of yourself and taking care of your family.
Fantastic. And gentlemen, we wish you all the best luck with the new innovations to come. Thank you for giving us a sneak peek and also for bringing in your expert opinions from your own specialist areas as well. Aman, Mark, Nabeel, thank you so much for your time here today.
Thank you.
It's been great to have the insight in terms of Sahatna. We look forward to seeing what's to come. And to my audience, please do give our panelists a big round of applause.